Did you know that bowel cancer is one of the most common types of cancer worldwide? Unfortunately, this is a disease that affects more and more people, and late diagnosis makes treatment more challenging. In this video, you will learn everything you need to know about bowel cancer, the main signs and symptoms, risk factors, and how to prevent it. Before we continue, don't forget to like this video and subscribe to the channel. Nearly 90% of people who watch our videos aren't subscribed yet, which means they might miss out on valuable health tips that could save lives. Now that you understand the importance of this topic, let's dive into the risk factors and warning signs for early detection of bowel cancer. Understanding the factors that may increase the chances of developing bowel cancer is essential for prevention and early diagnosis. Advanced age is one of the most relevant factors since most cases occur in people within this age range. If you have close family members who have had bowel cancer, such as parents or siblings, your risk may be higher due to genetic predisposition. In such cases, it is crucial to begin preventive screenings earlier, as recommended by a doctor. People with conditions such as ulcerative colitis or Crohn's disease have a higher risk due to chronic inflammation in the intestinal tract. Excessive alcohol consumption, smoking, physical inactivity, and obesity are factors that may contribute to the development of bowel cancer. Frequent consumption of processed foods, saturated fats, and red meats is associated with an increased risk of developing the disease. On the other hand, a diet rich in fruits, vegetables, legumes, and fiber can help prevent it by promoting a healthy intestinal tract. Although these factors increase the likelihood, it does not mean that everyone with them will necessarily develop the disease. Therefore, adopting a healthy lifestyle and undergoing regular screenings is the best way to reduce risk. Now that you know the risk factors, let's discuss the signs and symptoms of bowel cancer so you can recognize early warning signals. Prevention and early detection are the most powerful tools to fight bowel cancer. Small changes in your routine and regular screenings can save lives. Adopt a fiber-rich diet by consuming more fruits, vegetables, legumes, and whole grains. Avoid excessive consumption of processed foods, red meats, and saturated fats. Exercising regularly helps maintain a healthy weight, which is crucial to reducing the risk of cancer. Walking, running, yoga, or even dancing at home can make a difference. Excessive alcohol consumption and smoking are directly linked to a higher risk of bowel cancer. Take the first step to quit these habits today. If you have a history of inflammatory bowel diseases or relatives with bowel cancer, inform your doctor and undergo stricter monitoring. Colonoscopy is the most effective test to identify precancerous lesions or detect bowel cancer in its early stages. This procedure allows doctors to remove polyps before they become cancerous. For people over 50, it is recommended to undergo the test every 10 years or as directed by a doctor. Tests for occult blood in the stool can indicate intestinal bleeding, a possible sign of cancer. If you notice blood in your stool, changes in bowel habits, or persistent abdominal pain, see a doctor immediately. When bowel cancer is detected early, the chances of cure increase significantly, and treatments tend to be less invasive. Even without symptoms, undergoing regular preventive screenings can save your life. Taking care of your health is an act of self-love. Adopt healthy habits and keep up with your screenings. Prevention is in your hands. Now that you know how to prevent and identify bowel cancer early, let's explore the treatment options available if the disease is diagnosed. When diagnosed, bowel cancer has several effective treatment options. With proper medical care, it is possible to treat and often cure the disease, ensuring the patient's quality of life. After suspicion or diagnosis of bowel cancer, the doctor conducts detailed exams to determine the stage of the disease and the tumor's exact location. The exams may include CT scans, MRIs, biopsies, and colonoscopies. The stage of the cancer, localized, regional, or advanced, defines the most suitable treatment options for each case. Surgery is usually the first step in treating bowel cancer, especially in early stages. During the procedure, the doctor removes the tumor and, if necessary, part of the affected intestine. This may involve a partial or total colectomy, depending on the tumor's extent. In advanced cases, creating a stoma, an opening in the abdomen for stool passage, may be required. Chemotherapy uses medication to destroy cancer cells and is often recommended after surgery to reduce the risk of recurrence. It may be indicated in advanced stages or as palliative treatment to control disease progression. Radiotherapy uses radiation to destroy or reduce tumors and is especially useful for treating rectal cancer, the final part of the large intestine. It is often combined with chemotherapy before surgery to shrink the tumor. Targeted therapies involve medications that directly attack cancer cells, blocking tumor growth. They are most often used in advanced cases when cancer has spread to other organs. Immunotherapy stimulates the body's immune system to recognize and fight cancer cells. Although not yet widely used for all cases, immunotherapy has shown promising results in specific types of bowel cancer. Each patient is unique, and treatment depends on factors such as age, overall health, and cancer stage. Teams composed of oncologists, surgeons, nutritionists, and psychologists help ensure more effective and humane treatment. Taking care of mental and physical health is essential during treatment. Complementary therapies, such as physiotherapy and psychological support, can improve quality of life. A balanced diet adapted to the patient's needs aids in recovery and treatment tolerance. When detected early, bowel cancer has high cure rates. Even in advanced stages, treatments can extend and improve quality of life. With medical advancements, treatment options are increasingly effective. Regular medical follow-ups make all the difference. The treatment of bowel cancer requires dedication and support, but it can be overcome. Don't delay seeking medical help if you notice warning signs. Your health deserves care and attention. If you found this information helpful, share it with those who might need it and help spread awareness. Subscribe to the channel to keep receiving valuable health tips.